Good morning, everyone. I think now is a good time to start. A lot of people have started to join. My name is Helen Wilcox, and I'm at the Global Health Network. I'd like to welcome everyone to this Global Health Research in Focus lecture, which is brought to you by Global Birth Defects and the Global Health Network, and importantly marks World Birth Defects Day today. Thank you very much for joining, and today we're delighted to be joined by Dr. Leke Aminkeng, who's a Research Associate in Birth Defects, Professor Helen Dolk, Professor of Epidemiology and Health Services Research, and Katy Karnell, Research Assistant, all based at Ulster University. Leke, Helen, and Katy will be presenting on how to collect birth defects data using the Global Birth Defects Description and Coding app. I'd like to firstly go through a couple of points of housekeeping. We will open the floor for questions following the presentation, so please use the Q&A function. This lecture will be recorded and shared on the Global Health Network within the next few days, so please share with your colleagues and friends. And you can also find our previous Global Health Research in Focus lectures by visiting hub.tghn.org/infocus. You can follow the Global Health Network and Global Birth Defects using the handles you can see on the screen, on Twitter, and via the Global Health Network. I'm now pleased to introduce our session today. Global Birth Defects is one of our 41 knowledge exchange hubs within the Global Health Network, and we partner with several organisations and research consortia focused on the first 1,000 days, including Global Birth Defects, Integrith 21st, and Pedicap, to name a few. Global Birth Defects was set up by the International Committee for Congenital Anomaly Surveillance Tools as part of the Zika Plan project, funded by the European Union's Horizon 2020 Research and Innovation Programme. Global Birth Defects is a collection of guides and materials to assist with the diagnosis and surveillance of congenital anomalies for health research professionals working in birth defect surveillance systems, public health, and pregnancy cohort studies. The Global Birth Defects team have prepared a short introductory video which we'll now share with you.
Greetings from Global Birth Defects, an initiative funded through the European Union Horizon 2020 Research and Innovation Grant. We are part of the Zika Plan project. We aim to build stronger birth defect surveillance systems that improve birth defect prevention and care of affected children. We think our new app is innovative. It's easy, it's visual, it takes volumes of information and organizes it in an accessible way. We believe it will make your data collection not only easier, but also improve the quality. This is one app, but your access to the basic or surveillance version simply depends on the registration code you are given. There is no need for multiple downloads. If you have multiple team members who want to use the same tablet or phone, each user will have his or her own login details. The app aims to improve your description and coding of major external congenital anomalies so that you, meaning your research center or health surveillance system, have the data you need for research and program planning. It is designed for low resource areas, where the clinical expertise needed is not available at the time of birth, so that non-experts can describe what they see more precisely. The app can also be used for health professional training. It is not intended as a replacement for clinical referral or expert diagnosis of a baby. The basic version is designed for building your knowledge about the different types of birth defects and how to identify them. This version is great for training purposes because it contains images, descriptions, and ICD codes for major malformations. It includes embedded instructional examination videos and links to resources freely available on the internet from trusted sources like the WHO. Now, the surveillance version is the basic version, but with additional functionality. The surveillance version extends the basic version to include the ability to record your anonymous case data and transmit it to your research center. This version is the one that existing surveillance systems or research projects can use to improve their data collection. Gaining access to the surveillance version requires an application because we must ensure that all the necessary ethics permissions are in place. In this surveillance version, members of your team charged with recording data on infants born with a birth defect will be able to record details about the case, including the ICD code of the malformation, the age of the baby, the type of birth, whether the baby was born preterm, and relevant observation notes. Depending on your local surveillance system's ethical approvals, this version can also include the ability to take a photo of the malformation. This recorded data would then be uploaded through a secure server and downloaded by your local surveillance system data center or manager, and can be matched with other data collected about the baby or mother. The purpose is purely to enhance the diagnostic information. We hope you will contact us to register for this app. We believe it's a tool that will solve some of your data collection challenges. Contact us. Thank you, and bye for now.
And now we'll pass over to Leke, Helen, and Katy for them to introduce you to this fantastic free tool.
Okay, thank you, Helena, and welcome everybody to this presentation of our app today, which is also marking the World Birth Defects Day. This is how we intend to proceed with our presentation today. We would have an overview of what Global Birth Defects is, and we would talk a little bit about the basic versus the surveillance versions of the app, and we will dive into how to record data using the surveillance version, and then show you how to access this data that has been uploaded from the server. And then we would have time for questions and then responses, which will be coordinated by Helena. So straight away, the Global Birth Defects initiative is part of the Zika Plan project, which is funded by the European Union Horizon 2020 Research Project Fund. And we have this website where if you go there, you can find resources on birth defects that have been put together. And this is particularly important for those in low resource settings because it's a kind of a one-bus stop that has everything on birth defects. And this inventory is continuously being updated. We also have a section that talks about the app. It gives more information about the app. And when you come in here, you can find information about how to register. For example, this is the registration code you will use for the basic version. And you can also find a lot of instructional videos on how to use the app. Additionally, on the website, you would find this feedback page where you can provide us feedback with various aspects that we are dealing with. As you know, this is a new project, and we are doing a lot of things. Just talked about the inventory and the app, and we want to continuously improve on what we're doing. So please, if you have any feedback for us, we would very much love to hear it. Just come here, click on it, and we would respond to your feedback if it was a question. Now, I'd like to take you back to start the first part of this presentation about the app, which is to tell you a little bit about the difference between the surveillance and the basic version. So the basic version of the app has the fundamental elements of the app, which is the images, ICD codes, the descriptions and neonatal examination videos and links to relevant materials. Now that is what everybody, or some of you who have downloaded the app now have. You have the basic version. Meanwhile, the surveillance version has an additional, it's the same, it has the components of the basic version, but additionally it has the option to record data. This is what is not available for use now. And so we want to showcase that today. And I'd like to mention that for those of you who have already downloaded and registered for the basic version, you've done that using the registration code XJNL. But for the surveillance version, you don't yet have it. For you to have a surveillance version, the institution or the surveillance system has to apply to the Global Birth Defects. And we would issue you with your registration code to unlock the surveillance version. But before you do this, your institution must have ethical clearance to be able to use the surveillance version. So that is it about the basic difference between the surveillance and the basic version. I will now take you to the main part of this presentation, which is to tell you about how the surveillance version functions in terms of recording data. So here we are at the home screen, and this is where you get in to register data for a particular baby. So let's imagine that you have a baby in front of you, and the baby has two defects, one on the head and one on the abdomen. And we select first the head to record data on the birth defect that is on the head. And there you go. You have all these different types of birth defects related to the head. And you're looking closely at your baby to see which of these images matches what your baby has. And let's say our baby has these. There you have a closer look of the image, and then you say, yes, this is exactly what my baby has, and you select that. And it takes you to this screen where you can find the title of that birth defect and the ICD code. And then you have other images that are related to that birth defect. Below, you would also find information related to the birth defect, including some links of useful resources. So if we go here on how to measure the head circumference, you would find that there's more information about that, and it further links to gives you information to many other links. Now let's come back on this page and scroll down. There is a very nice calculator here where you can record, input a small amount of data, and it will tell you the severity of microcephaly. So I'm going to say the head circumference of our baby is 27.1 centimeters, and our baby, the gestational age was 38 weeks, and the sex was male. And automatically you would find that the calculator tells you that your baby has severe microcephaly. Now, for those of you who have downloaded and registered for the basic version, so far you would have all these features available for you. But what you will not have is the next part, which is where you can enter the bed weight for this baby, and we're going to say our baby is between 1,500 to 2,499 grams. And we're going to say the head is disproportionately small. Now you also have in the surveillance version, the additional option of entering, describing neurological features or imaging findings for this birth defect. But we're just going to leave that for now and proceed and to record data for this baby. So this takes us to the page where you record data. Now, the first thing that you have to do is to enter data on to enter the reference code. Now, this is the code that is given to you by your surveillance system, and it is a unique code for that baby. So because today is World Birth Defects Day, we're just going to say our reference code for this baby is going to be World Birth Defects Day. Now we're going to say the age of the baby is 0 year, referring to the fact that the baby has not yet reached 24 hours, it's below 24 hours. So the baby has not yet reached 1 day, so it's 0 days. So the birth type, we're going to say our baby is live birth. And for term type, we're going to say our baby is a term baby. Now, notice on the notes field that the information that we entered previously regarding the head circumference of the baby has populated this notes field. We could as well add additional notes here, but we will just leave it for now. So we are fine with what the data that we've entered so far, and we tap on register this observation. And there you go. It says your observation has been successfully saved. And I hit OK. Now, if my baby had just this birth defect alone, I would proceed, I would end the recording process now. But because my baby has another birth defect on the abdomen, I'm going to go to record another observation. When you do that, it takes you back to the main screen, main birth defect selection screen, and I'm going to go to the abdomen, and then I see all these birth defects related to the abdomen. Now, notice that below you have limb body wall, umbilical hernia, and abdomen order. These are all different birth defects, but they do not yet have images on this app. As I said, the app would be updated in subsequently to have these images included. But for now, what our baby has in this presentation is something similar to this. So I hit on that, and the image enlarges, and I select it. Then I scroll down, and I find that I get the name of the birth defect and the ICD code along with the description. Then I can see that there are other images related to this birth defect. So that yellow link there tells you that there are more images, and I can scroll to the left to see more of these images. Now, I also want to call your attention that there is a dark blue link here, which indicates that there is a similar anomaly to this one. So each time that you see this dark blue link, be sure to click on it and verify whether the abnormality that you are seeing is what your baby really has. So I'm going to click on that, and it takes me to this birth defect, which says it is gastrocasis. And when I look at the birth defect, I see that visually it is different from what I previously was looking at. It doesn't have a membrane, and the organ is tilted to the side of the baby. And if you read the description, it will also give you more information about what this birth defect is, and you can make that distinction with what you were looking at previously. So, and of course, again, you have more images below to help you have a sense of what you are actually looking at. Now, I'm going to say this birth defect that I am looking at does not reflect what my baby has, and I'm going to go back to what I was looking at previously and say, yes, this is actually what my baby has. And so I'm going to record that. Now, it takes you to the page where you have to record information on this particular birth defect for this baby. Now, notice that the reference code of the baby is already there because you'd entered that previously. And that all other information that you'd entered regarding that baby is already stored in the app, and you don't need to enter that when you're recording this second birth defect for that baby. But you do have the option to enter notes related to this specific birth defect that you want to record now. So I'm going to say that the omphalocele was large, and contains most organs. Now, and I'm happy with that, and I hit register. Now, I have successfully recorded 2 birth defects for this baby, and I'm satisfied with that. And I return to the home menu. Now in the home menu, I want to see all the birth defects that I have recorded for that baby. I will go to the observation log, and there you would find the case, the information about the baby that you've recorded. So we only have 1 case that we've recorded. And if I click on that, it would take me to a page where it shows me the 2 birth defects that are associated with that baby. And I can click on each of them to edit whatever that I want to edit, but we're not going to do any edit now. And I can click on the second one to do whatever edits that I want to do. So we're going to leave it as it is now. And then you can decide that at this point, you want to upload this data to your surveillance system. Notice that so far, to use this app to record data does not require the use of internet. So, but to upload data to your central surveillance system, you will need internet. So I select my case, and I go down to options and select upload select cases. Immediately I do that, I receive a warning that uploading cases would automatically delete this data from the app. And I am fine with that, and I say, okay. And then I get a confirmation that upload is complete. And notice that your case is no longer there. So that is the end of our session for recording and uploading data. I will now take you to the saver where the surveillance system will see the data that has been uploaded. So when the surveillance system goes to the saver, they have a section of this saver that hosts their data. Only them can see this data and nobody else. So it is a unique section for them within the general saver. So this is where you go to log in. And then you find that this is the saver, and you go to this tab which says institution. Then you can see that on the first tab here, this contains information for those who have access to this saver. So for example, it could be the data manager for the surveillance system, and you could add whatever number of persons that you want them to have access to this data. This other tab here would show you all the contributors in the field who are using the app to feed you with data. Now, below you would have your cases that have been sent to you from the field using the app. And notice that we already have 3 cases that have been downloaded before, and you find that they're in orange. Now, today, we have uploaded 1 case, and notice that this is the reference code that we put in for that case, WBDD, marking the World Birth Defects Day, and the date of today. Now, you would also notice that the name of the contributor in the field that sent the data is also indicated. And the number of observations or birth defects that the baby had is also indicated on this field. So we want to download this data, and we would check this box and then hit on download. And then you would have this zip file here, which would contain your data. I open that. And you would find that there is, in that zip file, there's an Excel sheet that contains your data. And I hit on that. And there you go. This is your Excel file that contains all the data that you entered for that baby. So that is it for our presentation today. And I will now hand over to Helena to continue with the questions and answer session.